Good afternoon. We're doing Vera Ellen's SRT video. And so I'm going to go ahead and pull that up here. And Vera was seen for an ear infection the other day, and we ran some blood work. We found not too much going on, some inflammation. Wanted to follow up with a thyroid check in 3 months. So that says, well, we don't currently have any degeneration, which means it hasn't really affected a vital organ as of yet. So that's good news. Um, but it doesn't give us data to say, well, how do we exactly treat this then? So symptomatically, we treat with anti-inflammatory, we treat the ear itself as we're going through the process of recovery. So SRT gives us what they call dis-ease. Where's the imbalances that are occurring that add up to the symptom or the disease process? Because the body should be able to heal itself, and when the body can't do that, what happens is that we have a resistance or an obstruction to recovery. And so it becomes biologically purposeful, instead of have a normal ear, is to have an ear infection, to have a skin problem, to have a UTI, to have an ACL injury. Those become the norm. And so they're prone to disease, injury, symptoms, things like that. And so what we hope for Vera is that when we clear up these imbalances, that she can make a recovery and be more functional and less symptomatic. So this is the SRT. Page 1, at the bottom of every page, you're going to notice that there's different colors if you have a color-coded one, or just the legend that says, okay, middle is balanced, to the right is acute stress, which means that that's happened in the last few months. And chronic stress says this has been going on for more than 6 months. So these are the ones we're really looking at in chronic disease. So at the top here, we see some acute stress, but that's there again, it's something recent. So acid-base balance was something that recently set off the symptoms. Antioxidants, so we're not producing sufficient antioxidants in the body, so that can create free radicals. And there seems to be something up with the anterior thigh, whether that's symptomatic or not. She's 9 years old, so there's maybe some aches and pains associated with that. As we get down further into page 1 here, we see head and mastication. So that's chewing. So the head and the chewing mechanism can affect the ears. And so we have to go outside of the box in our thinking in terms of, okay, what is causing the chronic problem? So that's one area. And then immune boosters. Also lower limb and muscle. There's another muscular one, except it's on the chronic side. So that relates to the lymphatics and range of motion, which can affect the skin. It can affect, of course, the UTI, because if they're not getting good outflow of urine, they have backflow problems, or they don't empty the bladder properly. Certainly, the muscles especially the back leg, can affect how that urine is released. And so, second page here, we see muscle again. And then we get into neurotransmitters, so the nervous system, some bacteria and viral, and then we get into organ systems here that's showing some weakness. And because we did the blood work, we know that there's nothing that's permanently damaged here, but it suggests that over time, if we don't clear it up, which we will when we give the drops, is that it could cause more permanent disease problems. Parasites show up because of exposure to parasites, but at the same time, did we clear that? The effect of parasites, and in fact, is we did not, but we will. Parasympathetic nervous system is also related to the relaxation response versus sympathetic being fight or flight. As we go further down, we see some scars and adhesions that could be from previous injury or surgeries. And then we get into the skin here. We see some chronicity of the skin. And further down there, again, we get into torso and muscle things. It relates to maybe the urinary tract. And then page 3, we get a lot more. And so it gets pretty busy. But the takeaway is not so much the details. It's that, what is this test really reading for us? And as you notice here in the second column, we see body points. And then we get into bio points, which are related to the environment. And so we see there's a ton of environmental resistance going on. And so when you see like too numerous to count, sometimes out of the 145, we at least have over half of those as stressed, is that we've got to clear up quite a number of things. Now, the goal is that after giving the 5 drops a day of the hemp oil, as we reset and recalibrate and restore, gives the Vera Ellen time to regroup and to heal. If she's symptomatic, we may use the steroid as a way of controlling symptoms. Certainly, she has additional diseases or symptoms, we can certainly manage that. But the goal is step 1, get the dis-ease under control. Step 2, control the symptoms as holistically as we can. And step 3, if they are uncomfortable, like we're moving into prednisone to help, that can be our support while we're in recovery phase. So the first step, I know it's a lot of information. Blood work is a lot simpler. You got just a few things to go over, where SRT, you got a ton of things. So if there's any individual things you want to talk more about, shoot me an email on that. Certainly the follow-up is in 3 months for the thyroid, but in between there's going to be, you may have discussions or new symptoms or some things we have to clear up. Maybe want to refill the prednisone. We can certainly talk about that. So review the video, see how, give me some feedback on it as you wish. This is a new thing with the videos, so I'm using a company called Vidyard here, so hopefully this is going to work out. I've got a Yeti on and some headphones and get kind of sophisticated here in my recording, so hopefully this is going to work out fine. Thanks so much.